Hey, this is Dr. Story. I've been a chiropractor for over 23 years. I'm going to give you realistic advice based on my experience. What I'm doing here is I'm just looking at an x-ray. I wanted to make sure if a person had a bone spur, and this is for plantar fasciitis and bone spurs in the heel. And it's very common to see a bone spur when people have plantar fasciitis because I'm going to show you exactly how it happens. Now I'm going to move the x-ray a little bit, and what I'm going to do is I'm going to show you on the x-ray how this works. So what's happening here is we're actually looking at the x-ray. Right up in here, this is the actual tibia, and this wider part down going like this, that is the fibula. That's on the outside of the ankle. This bone right here is the talus, and that bone is what allows our foot to go up and down. This is the bone, our heel bone. And look how much thickness there is between the heel bone and the actual foot. Look at the difference there. Right there at the bottom, right at the bottom of my fingernail is where the bottom of the actual person's skin is. Now, usually right about here, right there on that area, you will see a bone spur when people have plantar fasciitis. And people think that the bone spur actually causes the pain. It does not. This person has severe plantar fasciitis, which means they have pain right in the soft tissue area here, but there's no bone spur, which is interesting. So I'm going to use this little arrow right here. Their pain is right here, and usually you'll see the bone spur. Now, if this patient does not get better with their plantar fasciitis, what's going to happen is right along the end there, called an enthosopy, the body is going to start laying down more calcium as a result of the stress on the soft tissue, and eventually he will develop a bone spur right there if we don't get it. Now, what's interesting is for most bone spurs, I'm going to tell you a little secret. The secret to success of treating a patient that has a bone spur or does not have a bone spur, if they have plantar fasciitis back here, it's to stretch the calves. And you can see back here where the Achilles tendon is, and stretching the calves for 9 minutes a day usually helps resolve most cases of plantar fasciitis. I'm going to be adjusting this bone right here, this calcaneus, and the joint that I'm going to be adjusting is called the subtalar joint because on physical exam he had a everted subtalar joint. So we're going to adjust him. We're going to use laser. I'm going to have him stretch his calves, and we're going to get this plantar fasciitis better. But if this patient had a long-standing plantar fasciitis, we would probably notice right in here a bone spur, and the most common question is, should I have that bone spur removed? What's your answer? The answer is actually no, do not have the bone spur removed. Why? Because the bone spur is simply a reaction to the long-term calf tightness and long-term strain at the bottom of that area. You treat the soft tissue and get the joints and soft tissue to work better, and the pain goes down. The bone spur is the red herring. So that's why I say don't have them removed. If you thought this was interesting in how we look at x-rays, give me a thumbs up, subscribe to the channel. If you have any questions at all, you can ask in the comments section below. And please share this with other people on social media like Facebook and Instagram. It might help someone understand what they're looking at when they look at an x-ray. And if you have any questions, ask in the comments section below.